In this lesson, we'll review coding rules and tips for patient encounters and office visits. After completing the lesson, you'll be able to define E&M as a medical term, explain which type of code represents the what in patient encounter, explain which type of code represents the why in a patient encounter, list the difference between new patient and established patient visits, describe the difference between key component coding and time-based coding, and describe when it's permitted to code for nurse-only visits. Evaluation and Management, or E&M, is the term you'll use to select an office visit code. We'll refer to E and M during this lesson. Every service has been translated into a medical code. This allows you to give the insurance company who pays for a service the basic information about what happened during a patient's clinic visit, or E&M. Start your documentation with why the patient came in for a service. Use the ICD-9 code for the diagnosis or for the symptom assessment if there's no confirmed diagnosis. Next, the CPT codes tell the insurer what procedures were performed, including most medical procedures and immunizations. HCPC is an acronym for Healthcare Common Procedure Coding System. This is another set of procedure codes used at public health clinics primarily for injectables and pharmaceuticals. To find the most current codes, refer to the current year's manual. To make sure you're using the most up-to-date codes, you'll need to purchase the current code book. You can order code books online at most retailers, including Amazon, or pay for online access. For CPT codes, the book is called the CPT Standard Edition. For the Healthcare Common Procedures Coding System, the book is called the HCPCS Level 2. And for the ICD-9 diagnosis codes, it's the ICD-9-CM. For a refresher on these three guides and where to order them, you can print out the downloadable job aid, Your Guide to Medical Code Books. Be prepared to purchase the new versions of the CPT and HCPCS every year in January. The ICD-9 code books are purchased in October each year. At this time, a new revised coding system, ICD-10, is expected out in the near future. Your clinic should use a form referred to as a superbill, fee ticket, or encounter form. No matter what you call it, this is where you enter medical codes used for billing. It's important to check with your clinic billing team or clinic manager annually to make sure that the superbill form is kept up to date. Old codes entered on an out-of-date form can mean that a service gets denied by the insurer. When coding for E&M, you'll need to specify if a patient is new or established. New for your local health department is defined as a patient who has not been seen by any provider in the department for 3 or more years. This rule applies to all providers in the group who are within the same specialty. An established patient is defined as one who has been seen by a provider in your department within the last 3 years. You have 2 options in coding your patient encounter. The first is known as a key component. The second is known as time-based. It's important to meet the specific criteria for the coding option you use. In the next few slides, we'll review this in more detail. The American Medical Association has established 3 key components for E&M services. These are the patient's history, the medical exam, and medical decision-making, which includes the treatment plan. Your E&M must include all 3 to be compliant for a new patient. Key component-based coding for an established patient follow much along the same rules. Key components are patient history, exam, and medical decision-making. The difference for established patient coding is that you only need to meet any 2 out of the 3 components. For your convenience, a summary of key component coding for both new and established patients is available on the downloadable job aid E&M Resource Guide. When counseling or care coordination dominates more than 50% of the billable provider-patient interaction, you'll want to use time-based coding. Time-based coding begins at the point of the face-to-face encounter. Remember to document a summary of the topics discussed as well as the time spent. These are among the rules you'll need to follow in the E&M guidelines. Time-based coding is complex. For more details, see the job aid referred to previously, E&M Resource Guide. A nurse-only visit is a brief interaction with a patient with an ancillary provider. Common examples include follow-ups, administering a pregnancy test, or providing test results, counseling, and education. In all cases, these visits use the nurse-only code of 99211. If you're not sure if a brief encounter applies under this code, check the payer's billing rules or ask the clinic billing staff for assistance. You can find the nurse-only code rules in the E&M Pocket Guide or refer to the job aid E&M Resource Guide. Now please follow the instructions to take the quiz for this lesson. It'll look familiar. It's the same one you took before viewing the lesson. This time you'll be able to see the correct answers as you respond to demonstrate what you've learned. After you've completed the quiz, you may continue at your own pace to view subsequent lessons at your convenience. The lessons are ordered so you'll build your knowledge of each part of the billing process that relates to your role. When you finish all the lessons, you'll be able to print out a certificate of completion to reward your efforts. Thanks for your attention. Please continue on to the quiz.